From a very young age, I kind of always liked to help. And I think maybe partly it's self-driven interest, partly it's parental guidance, where I was kind of encouraged to be a medical professional, encouraged to be a doctor. And honestly, at that time, from I would say secondary 2 onwards in my ACS days, I was very interested in the heart. And I kind of always wanted to be a cardiologist. In fact, I wanted to specifically be a pediatric cardiologist. That is until I went into the world of eye during medical school. And I was like blown away. I was like, wow, such a small organ, such an intricate organ, such an important organ, which requires so much expertise, and there's so much we can do. And more importantly, I'm generally quite an impatient person. And ophthalmology is one of those specialties where one day a guy cannot see and the next day he can see with a relatively straightforward, wonderful procedure like cataract surgery. So in the 2-week rotation in medical school, and we're only exposed to ophthalmology for roughly 2 to 3 weeks in a 5-year program, I was amazed at the mentors that I had and the kind of work they were doing in the Singaporean context. And that drew me to find out more about ophthalmology. And I subsequently did another 6-week elective in the US, in Wisconsin, and I was sold. I was like, this is what I want to do. Well, essentially, when I left for private practice, I was actually enjoying practice in a restructured system. I had just set up this global ophthalmology division for the Singapore National Eye Centre, where we were doing MOUs with regional partners in Southeast Asia and beyond in the US, and we became a WHO collaborating center. So I enjoyed my work there. And when I forayed into private practice, I wanted to bring with me that ethos of, can I bring evidence-based, superlative, specialist care to more in the community? Is it only a domain for the rich and insured? And I was privileged to work alongside my partner, Dr. Jayant V, and we have won many awards, both regionally, internationally, and in Singapore for community work, for bringing eye care to more people. And I figured if I go to private practice, I don't want to lose that ethos. So, of course, we set up our main premium flagship center in Camden Medical Center, the Straits Eye Center, but I wanted to ensure that alongside, I set up an equally well-equipped center in the community, and we started off with the Community Eye Specialist Clinic in Bedok. And that proved to be a success. And in the last 3 years, we have grown from 1 clinic to now 7 clinics, both specialized in ophthalmology, in eye surgery, and also geriatrics, so that we can serve more in the community. So I think that's been our mantra for growth. I'm really enjoying myself in private practice because we're able to hopefully create that change. And I realize many of my colleagues are starting to look into this as well. Essentially, we are a specialist eye practice, and also we have specialist geriatrics. So the aim is a 2-tiered system wherein we bring care in a premium center like in Camden Medical Center, but also in the heartlands. So this necessarily means we are trying to see which is the most impactful conditions that we can work with to allow for better impact for our patients and heartlanders. So I would say the main focus would be conditions such as cataract. We are an aging population, and 1 in 4 of us are going to be over the age of 65 really soon. Everyone over the age of 50 has a cataract. Whether it affects their vision or not is a separate question. And these things can be addressed pretty optimally in our center with a success rate of over 99%. So that's our main service, I would say, cataract surgery. And of course, as you know, Singapore is the myopia capital of the world. I think we probably have the most number of people with short-sightedness per capita compared to anywhere else in the world. So we have set up a myopia center in order to address this whole flood of myopic patients. So we have all the latest in the ability to treat them, manage their myopia, reduce the chance of its progression. So we are also targeting younger people who have gotten myopia in order to better manage them, better address it, and keep the myopia low. So we are working hand in hand with the government's initiatives for this. And in line with the government's Healthier.SG program, honestly, conditions like glaucoma, conditions like diabetic retinopathy, right? These things are causes of irreversible blindness and morbidity. If we detect them early, we can keep them from causing people to lose their vision, right? In line with the government's Healthier.SG program, we are targeting our middle-aged people, our younger people like myself, maybe in their 30s, 40s, 50s, so that we can detect diseases early. when we detect glaucoma at an early stage, before it even affects the patient. Because many patients tell me, oh, I have glaucoma, but the doctor gives you so many medicines, but I'm okay. What? The problem with glaucoma is it's called the thief of sight, because it tends to take away the peripheries of your vision before you even know it. By the time it starts affecting the center of your vision, which is when you might start noticing symptoms, it might be too late. It might be in its advanced stage. So our job is to detect glaucoma at an earlier stage. Unfortunately, with an aging population, with a high number of people with short-sightedness or myopia, there is an increasing incidence of glaucoma. But the good news is when we detect it early, the risk of people going blind from it or having vision impairment from it is significantly lower today compared to 30 years ago, because more people are aware of this condition. So what are the treatment strategies we employ? Well, that's where the art of medicine meets the science of medicine, because of course with latest evidence, we're able to protocolize certain ways of how we do testing, the type of glaucoma a person has, and how we stage it. And based on it, we have certain treatment protocols we ought to follow with the latest evidence. But we have to individualize it to each patient. One solution doesn't work for the other person. And that's where it's an exciting field where we have at our disposal various latest tools to manage glaucoma so that people live with good quality of life without this being an impediment to them. As a glaucoma subspecialist, I think glaucoma is one of those conditions like diabetes where I work hand in hand with the patient. The patient needs to be aware of their condition, because I can prescribe a treatment. If the patient doesn't follow the regimen, I fail in managing the patient. So I think patient communication is key. Patient understanding is key. And many times we get referrals or patients come to us for second opinion, largely not because the doctor is not that great. Many doctors in Singapore are very well trained, but it's because perhaps there was a gap in understanding of the disease, perhaps because of the time spent, or they don't get a clear picture. So for every patient, regardless of the language they speak, be it Tamil, be it Chinese, Mandarin, Hokkien, Malay, we ensure we have adequate number of staff who are able to translate this properly. And we have AI-powered tools to help us also better translate, so that we ensure that by the time the patient leaves the clinic, they have a much better understanding of their condition, so that they understand what we are doing to help them have good quality of life through their disease. So I think we spend a fair amount of time, necessarily so, explaining about the condition, explaining about the management strategy, so that we together, in a collaborative manner, choose the right treatment strategy that works for them. And this is key to our management of patients in a very good way. And that's what I think differentiates us, and we hope to keep that. So when we first started the Straits Eye Center 3 years ago, we continued to be located at Camden Medical Center, which is near Orchard Boulevard MRT and near Tanglin Mall. That's where our premium flagship center is. We now have 2 centers here. In the last 3 years, we have built a total of 7 centers. So we have 2 main centers here, one for kids and one for adults, because they have 2 different sets of diseases that we need to help better optimally manage. We also have another center of excellence in Parkway East Hospital. On top of that, we want to ensure that this level of care can be provided to our heartlanders. So we have set up community specialist clinics in Bedok, in Clementi, in Toa Payoh, and we have purposely chosen them to be geographically apart so that more people can access our care. And we realize we are an aging population, so we are working with our Straits Geriatrics partners, our sister company, and that has a clinic in Gleneagles Hospital as its flagship, and also has a community clinic in Toa Payoh. On top of that, they provide home-based care. So we are bringing our expertise, even eye care expertise and geriatrics expertise, to people's homes. And we can do that now with good quality because many of our diagnostic tools are AI-powered, and it allows us to be able to send manpower to people's homes to better detect diseases and better manage them.